Samuel, it's Dr. Buford. I'm here, the rest of the shoulder team. We're looking in the left shoulder. You're laying on your side just to orient you so your arm is being supported up in the air. We're looking from the back to the front, so you see this clear cannula coming in the front. The opening in that cannula is only about 5 millimeters, just to give you actually it's a little bit bigger. It's about 7 millimeters, just to give you an idea of the magnification that we're working under. We're going to go ahead and put a shaver in because we use it as a pointer and also just to debride any rough areas. So, hold the camera, please, right there. And so we're going to start right here, debride a little bit of this labrum. And then we're going to look up there at the biceps tendon. Now, the biceps anchor and the superior labrum is right here. One of the things that determines whether or not we have to do anything is what the cartilage looks like here, because everyone gets some normal wear and tear changes. So as you look down at the cartilage, we can see that in your shoulder, the cartilage really isn't cracked. There's no fissures, and there's really no signs of any tension or stress on the superior glenoid cartilage here. And so I think this is just normal insertion, even though you can see there's a little bit of play there, but that's normal. I don't think we need to do anything to repair that because I don't think it's an injury. And that's one of the things we use to diagnose a slap lesion, okay? So, however, as we look to the right of that, this is a tear in the rotator cuff tendon right here. So here we can see this tear, and we know from our imaging that it's essentially a full thickness tear. Hold on. So we're going to go ahead in just a minute here and debride that a little bit from this side, this articular side we call it, because we're inside the joint. See, it's a pretty extensive area here. This is where the tendon's pulled away from the bone. So we can see that, the width of the shaver is about 5 to 6 millimeters. And so we can see we've got at least about a 75% tear here. But we know, again, as we look up in there, you can see it goes all the way through. There you can see there, it goes all the way through in the front as well. So we're going to debride this a little bit more. We'll look towards the back of the joint on the inside, and we'll show you when we do that. So now we're looking towards the back of the shoulder. We're still inside the joint, and this posterior aspect of the joint looks great. Here's the posterior capsule, normal insertion into the humeral head. The posterior humeral head looks fine, no signs of any cartilage damage. There's really no significant arthritic change at all. And then here's the area in the rotator cuff that we debrided. So we're going to go ahead and change positions with your shoulder in just a minute. Okay, so we're looking in the subacromial space. The burr that you see is coming in from posterior. It's coming through a blue cannula we call a dry dock. The anterior part of your shoulder is here to the left, and the camera is coming in from the side. So we're about to do what we call an acromioplasty, or a limited acromioplasty. Your AC joint is going to be way over here. See, that's the end of your clavicle over there. We're not going to be doing an AC joint resection. That's very different from an acromioplasty. We're going to just be working on the acromion. We don't start back here because the acromial spine's back here. So once we identify the AC joint, we know that that's as posterior as we need to be. So we're going to start the burr here. We're just going to sweep from medial to lateral, just like this. We've already done part of the work before the video, because we started with the camera in the back of the shoulder. So part of this has already been done. That's why you see it this way. But the real key here from this position is to look at the front of the acromion, the anterior edge, which we're going to rotate the camera. If you watch, you see how the camera rotates? And now we can see the anterior edge of the acromion. This is bone right here. So here's this bone that's just above the rotator cuff down below. And here we're going to start the burr. And you can see we're going to be removing this bone from here to here. This bone from here to here is what we're going to remove. The reason we're doing this is to make room for our rotator cuff repair. And now we just take a little bit of time to level off the acromion. while making sure we get all the way lateral. Okay, so now you can see that lip of bone that was hanging down is gone. We have lots of room now from the rotator cuff down below to the acromion above. You can also see how we've not done anything to violate the AC joint. There's the end of the clavicle right there. So we've done nothing to affect the AC joint, and we've done this acromioplasty. Okay? So once again, here's the AC joint over there, medial, and here we've just been working on the anterior edge of the acromion. And so now we'll go ahead and go off on the video and show you some more in a minute. Okay, so we've identified the tear, and another little interesting finding with the biceps. Here's the tear in the tendon right here. It's in the anterior portion of the supraspinatus. You always check, you always check the posterior extent of the tear by seeing where it reinserts back here. And it looks like we need to open up maybe just a little bit more, but for the most part, that's going to be the size of the tear right here. The other thing we found that we didn't want to find is that the biceps is a little bit torn as it comes across here. See that? So I'm concerned about that. We're going to put a stitch through the biceps here and suture it because we don't want to have that tear on you. You can see how the biceps has some fraying there. Okay? Positive. Okay. Okay, so here we've looped a suture around the biceps a couple times. It gives us a very secure hold on the biceps. And now we're going to reach in here and we're going to cut it deep inside where it inserts into the labrum, way down there. So we'll show you some more in just a minute. So here you can see the sutures holding the biceps securely there. Okay, so we've released the biceps so we can secure it later. There you can see the cut edge of it. Okay, right there. We'll deal with that in a little bit. First, we're going to go ahead and make sure there's no bicep stump remaining that we have to worry about. So we'll put our shaver in and we'll look underneath here. And there's the bicep stump, and that actually looks pretty good. Shouldn't cause any problems there. So here's our spinal needle. This just helps us plan our suture anchor placement for the rotator cuff part of the repair. Looks like if we place an anchor here, that's going to be a pretty good spot. Okay, so here's the tear. You can see that's posterior to the right. Okay, the smooth cartilage, that's the articular margin right here. And so we're going to place an anchor in right about here. This is a triple loaded anchor, meaning there's 3 sutures coming from this one implant. Goes all the way down to the bone. We'll unload the inserter. In just a minute, you'll see all 3 sutures coming off. You see the anchor right pulling back on it. And that's very, very solid. Okay? And so now the next step is to go ahead and start manipulating our sutures. We're going to take out one of the sutures on the left side of the screen, which is anterior. Hold that finger. I'm going to reach in here and take out the black and white striped suture first. So we'll take this one here. We're going to take a grasper in the left cannula and a specialized sewing needle in the right. There's the grasper on the left. This instrument's called the Spectrum suture hook right here. Up on the cuff. Place our first stitch back here. that. Back up a little bit. Okay. I'm just going to load. We'll go ahead and load that black wire with the suture. And then as we pull back slowly, you'll see how it brings that black and white striped suture. See, right there, it brings it. And it's going to come out right over here into this cannula. So we'll pull tight. Brings it underneath. And now we're going to reach in with our crochet hook and get the partner suture. Now we're going to do the same thing 4 times. The next suture we're going to work with looks like this blue and white one's kind of teed up and ready to go, so we'll take that out next. And now we're going to take a suture hook that's a slightly different curvature. This is called a turn to the left. It's a 45-degree turn. You can see how this, we're going to go in like this and then turn it so it comes out like that. Reduce it like this. Pulling the second stitch back underneath. There it goes there. We're going to take a grasper. We'll take that loop out so we don't have any tangles or twists in our suture here. Now we have that set. Now we have 2 sutures passed. We haven't tied anything yet. And we've got 1 more to go. There's a little loop here that I'm going to take out too. So I want this blue suture to slide freely. So we'll just pull this out that way. And now everything's free and clear, as you see there, okay? So the next step is to go ahead and pass the suture from left to right, from anterior to posterior. We're going to take this suture out the back in just a minute. And now we're going to place in our suture hook. There it is there. You can see the tear. We're going to hold this reduced about here. We're going to try and come into the tendon. Now we're ready to start tying sutures for the cuff. So we've moved all the sutures anterior, so all the sutures are going to the left, and now we're going to start tying one at a time. Here's the black and white suture that we passed first. We'll take this one out, and of course we've got to get the partner suture. We want to make sure there's no twist, so we'll have a good close look here. How we want to retrieve this. So we'll pull that out just like that. And now we have a loop of suture that we can tie to suture the cuff here. Pause. Okay, so we've got all 3 sutures passed and tied for the cuff repair, and this looks good. There's the black and white one in the back, the blue and white one in the middle, and the solid blue in the front. And as we rotate, you can see how that moves together as a unit. However, we are not done because we've still got to deal with the biceps. Remember, the biceps we had to release. So we're going to reach in here and grab those bicep sutures. There they are. I just want to put in place someplace where I can see them. And now we're going to move the camera to the back. Okay, so here we've got the bicep secured. We're going to place a hole in the bone for our next anchor right next to the biceps. That's going to go right about here. We're going to tap this down. You saw that little black laser marking go all the way down. And now we're going to load the next anchor. Load this anchor and then we'll show you some more in a minute. Here's the anchor. We're going to tap it down into the bone. Right about there, we stop so we can tension it. Okay, now we've released it. The biceps firmly anchored, you can see the stump of it here, and that should be just fine. We may take a little bit of the stump off, but basically it is securely fixed right there. So I'm very happy with the way that looks. We're going to finish up here and get you back to the recovery room shortly. Good luck to you now. Bye-bye.